The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what's new in breast surgery? With us, we have an expert on the topic, probably Arizona's busiest breast surgeon. He has a center that's dedicated to just breast surgery, Dr. Robles. Dr. Robles, welcome to the program.
Thank you, Randy.
All right.
Welcome. Glad to be here.
Now, before we get into today's topic, tell me a little bit about your practice. I guess you do all types of breast surgery?
Yes, I do mainly aesthetic breast surgery, which could be a patient that wants her breasts to be bigger. So I'll do a breast augmentation. Mm-hmm. Could be a mother that doesn't like her droopy breasts and now wants her breasts in a better position, and she might not like her volume. So I'll also, give her a breast that where her nipples will be perkier. Okay. And she'll have a nice natural volume. And I also do patients that have breasts that are way too big, patients that have a lot of neck pain, a lot of shoulder pain. And in those patients, I reduce their volume and then give them a nice, perky, full volume breasts where they can exercise, not have pain in their back and their neck and their shoulder. And then I also do a lot of redo breast surgery. And those are patients that have had a bad result, either from a breast augmentation, from a breast lift, and they come to me and I correct them. If they have a really hard breast or a really high riding breast implants almost in their neck, then I'll go ahead and fix that, make it look more natural, more soft, have the implant in the right position. So I really enjoy what I do. I really like the aesthetic part of plastic surgery and mainly the aesthetic breast surgery part.
Interesting. Today we're talking about this rapid recovery breast augmentation. And we talked on the phone. I was very skeptical, by the way. We talked on the phone. And you know this. I mean, doctors from all over the country, from Canada, they come here, and I get a chance to interview a lot of doctors. But on the phone, you really because I didn't quite get this rapid recovery. I thought maybe it was a gimmick, to get more patients in. And you were very strong with me on the phone. Randy, this is no gimmick. It's the way you, I guess, design the breast and the way you do this. Is that right?
That's correct. This is not a gimmick. This is just refining the traditional breast augmentation and doing it to where a patient has a much faster recovery, or a rapid recovery, if you will. And they're able to go, either out that same night. I had a patient that told me she went out shopping and dancing the same night of her breast surgery.
Now, your surgeries, you say, and we have to be careful because, by the way, this is not an endorsement for the doctor because this is a real interview. Okay, we taped this, but this is your truth as you see it. But you say it's virtually a bloodless procedure, whereas traditional breast surgery, there's blood.
Right.
Is that correct?
That's correct. Yes. The way I do my technique is atraumatic. There's no trauma to the tissue, so that means there's going to be zero to minimal blood. Versus a traditional, they do it in a more traumatic fashion. The best way to describe it is that essentially there's just less trauma to the area.
So I'd have to see the surgery. Probably.
Essentially, you'd have to see the surgery, to know what was different.
Okay, is this one of the most popular procedures, by the way, breast augmentation, breast surgery? Is it beating liposuction these days?
Breast augmentation is one of the most popular, probably top two. In 2009, there was over 350,000 breast augmentations done in the United States.
And, and we talked on the phone, and I don't pretend to know what you do, but it seemed as though going into this, and I've done a lot of interviews, that breast surgery seems very straightforward. That of all the procedures in plastic surgery, that this is the easiest. What is your feeling about that? Am I wrong about that?
Randy, I disagree with you.
Okay.
Actually, it's not as easy as it may seem, and there's surgeons out there that
may believe that too.
May believe that too, exactly. But no, you have to have an artistic eye
to make them look. I mean, what is your goal? You want them to look natural. I mean, what is your goal? I mean, what defines a great breast augmentation or lift or whatever in your mind?
Well, it varies from patient to patient. So, in my mind, I take what the patient tells me and what they want, and I use my expertise in breast surgery to give them what they want. So it might be, some women might want a really full volume natural breast. Some women might want a little bit bigger and maybe not look as natural, but that's what's going to make them happy. So, because of the experience I have in aesthetic breast surgery, I can take what they tell me and give them what they want. And
now, because this is all you do, you think it makes you better? That this is all you're doing? You're not doing facelifting, you're not doing, tummy tucks. All you're doing is breast. You think it gives you an advantage?
Absolutely. I mean, I believe in, if you want to be good at one thing, you want to be an expert at one thing, you want to do that and do that all the time, and I take a lot of pride in that. I've used my experience, working with the pioneers at Duke in breast surgery, and use my, last 10 years of experience to perfect, and maybe I shouldn't say perfect, but to make women love their breasts and also be able to recover.
Rapid recovery.
In a rapid fashion.
So this means low downtime.
Yes.
Less pain. That means the recovery process. And by the way, is pain an issue? That means when you talk to women, is that one of their fears? Like, oh boy, this, it's a painful procedure?
Yes.
They worry about that?
Absolutely. One of the fears, and Randy, I had a patient a couple of weeks ago that, she had been wanting to have a breast augmentation for about 5 years, and it was always, the fear of pain, the fear of her prolonged recovery.
Interesting. I didn't know that.
And so I did a breast augmentation in a friend of hers, and her friend told her how fast she recovered. Her friend was out and about in a couple of days, and her friend was, just amazed on how she recovered. And she told her, and she came in a couple of weeks ago. I did a breast augmentation on her, and she can't stop, thanking me. She's extremely happy. She wishes she would have known about me, 5 years ago, because for the last 5 years, she hasn't felt, as comfortable as in clothes, and also she hasn't felt as comfortable, when she wears a bikini top. And
okay.
And this is, the way the technique I'm using allows for patients not to fear, being in pain.
Now the redo crowd, the women that have been in their breasts, because we get emails about this and referrals and things like that. And I try not to. Our site is not a referral site. It just shows my interviews. But I always say, go to somebody that this is their specialty. Like go to somebody that all they do is knee surgery if you want your knees. And this is very interesting. I've never met a doctor that all they do is do breasts. That's it. Is that rare? I mean, do you know guys that's all they decide to do?
No, most plastic surgeons, they kind of do the gamut of plastic surgery. They'll do facelifts, they'll do tummy tucks, they'll do some lipo, they do some breast augmentations. But that's, so that's a little bit more common than what I do. I love the aesthetics of breast surgery. It does, I can use my background, my mechanical engineering, background, because in some patients I have to, look at their before pictures, and also when I examine them and look at how what I'm gonna do, which is a process of designing, and then use my creativity and my artistic side to give them the result they want. And it's all. And when I talk to the patients, I listen to what they have to say. I don't just. They don't just come in and say, I want to be a double D.
Yeah, what do they say, by the way? Okay, on a consult, what are the frequently asked questions that you hear every time? And do they bring in a spouse, a significant other? And what are your thoughts on that? Do you encourage, if they have a partner, to bring them in?
Absolutely. I encourage for them to bring, their spouse. I do like, for if their spouse wants to, give their input, I listen to them. But it's a little bit more common for women to come in by themselves or with a friend.
Okay.
And when they come in, a lot of them, they're very anxious. And what
do they tell you? What do they want to know?
Well, they want to know. One of the first things they tell me is they don't want to look too big.
Okay.
They don't want to look like they have 2 watermelons on their chest.
Okay. All right.
They want, so that's one of the biggest concerns is size. And and I tell them, well, the size is going to be dependent on what you tell me you want to be, and then it's also going to be dependent on what your tissue will allow. In other words, what the diameter of your breast, how much tissue, loose tissue you have on your breast.
I mean, do they try things on? Do you have imaging? What do you do?
Well, after I get an idea, I ask them a question as far as what cup size they want to be. I don't guarantee cup size, but if they tell me they're a B cup size, they want to go to a D, I tell them I keep that in mind, and when I'm measuring you, that's what I keep in mind. So I don't have one implant that it will take everybody to a D. I really, specifically and individualize the consultation to each patient. So once, they tell me I want to go from a B to a D, when I examine them, and I always have my assistant with me, which helps me document things.
Okay.
When I examine them, I take measurements of their breasts, and again, that's a big determining factor in determining the size implant to use in that specific patient.
But do you see the end result in mind? I mean, when you examine a patient, do you say, oh boy?
Absolutely.
Really?
Absolutely.
You know right away?
Right away I have based on what they tell me, and then when I examine them based on what I see, I always have an end result, in my mind.
Okay, let's start with, by the way, because I have questions today about, and if you're just tuning in, we're talking about rapid recovery, low downtime, breast augmentation, breast surgery. Is that right? So, and it's all in the technique. Would you say less than 5% of surgeons, plastic surgeons, cosmetic surgeons in the country are doing it this way?
Yeah, that's an accurate assessment.
So it's your technique that's making it low downtime.
It's the technique. It's
in the dissection, am I using the right term?
Right. It's all in my surgical dissection, which essentially is making the pocket where the implant is going to be placed. And the way I do it is does
it require different instruments?
A little bit. Some of the instruments are different, specific, so that I can do a meticulous dissection.
Okay.
But it's not. This is not a gimmick, breast augmentation. This is a technique that is sound.
Less trauma on the patient.
Less trauma. I've been doing it for, probably over 7 years.
You told me on the phone, you said, Randy, it's taken me 5 years to perfect this.
And yes. And
so it's a lot of, it took you a long time.
Yes, because it does require, attention to, when you're doing the pocket, to be able to do it in a sequence that will then, in turn, give the patient the rapid recovery.
Okay, good. Now, by the way, are the patients that are getting breast surgery, and this is for anybody that doesn't like their breasts. This is obviously not for everyone. But are they getting older and older or younger and younger? What is the age range on the upper range of women that could do this?
Well, I've had patients. I had a patient that was 85.
Is that right?
And she was healthy, and she was remarrying, and it's funny, she said she never liked her breasts, but she always was afraid of being put to sleep or getting general endotracheal anesthesia, which, by the way, is not the way I do it.
Yeah, interesting. By the way, if they're just tuning in, we're talking about rapid recovery breast surgery with Dr. Robles, board-certified plastic surgeon. And so you also don't put them out with the tube down their throat.
Right. I don't put them out with the tube down their throat.
What do you do?
Well, Randy, I don't think that a patient should be exposed to the risk of general endotracheal anesthesia or putting a tube down their throat.
Interesting.
I think that the way I do it, the patient is safely asleep. She has all the monitors. And then I also do some things around the breasts to make them, feel comfortable while I'm doing the procedure. So they're not feeling anything while I'm doing the procedure. They're not going to wake up during the middle of the surgery. And it also helps them when, not only helps them while I'm doing the surgery, like I said, it also helps them when they wake up.
The recovery is...
Yes, they wake up a lot faster. They're up, they're smiling, they're moving their arms above their head.
On the same day?
On the same day. I have them showering on the same day. I have them making sure they wash their hair on the same day. I want them to move their arms. That also goes along with the rapid recovery. The faster they get back to their daily activities.
Well, this is interesting. So 85-year-olds can do this, because 70 is very young today. Seems like in Arizona, they're even healthier than most places in the country. So 60, 70, they're dating. If you don't like your breasts, you may want to take a closer look now.
Absolutely.
Because the pain is not something that should keep you from doing this.
Right. And not only the pain, but also the fear of general endotracheal anesthesia. And it's not just the 85-year-old.
So it's local? It's called local? You're doing?
It's not, I wouldn't say local. I think it's not local.
Okay.
It's a little bit, it's more involved than local.
It's IV sedation.
And the medication that is given is via IV.
Okay.
But it's not exactly IV sedation.
All right, okay. Now let's talk a little bit about incisions. I have questions about over the muscle, under the muscle, questions about where you put your incisions. There's a variety. Let's start there with incisions. I guess belly button, through the armpit, in the fold, the nipple. What's your take on this for the augmentation?
Well, let's start with the one that should never be done, and that's belly button incision.
But there's no incision with the belly button technique.
Well,
right? I mean, is that correct?
Well, there's no incision on the breast. But there's still an incision.
So you don't like it at all? You don't like it at all?
In my opinion, that is not a good approach.
It's a gimmick?
It's not a gimmick. I just think that there's too many potential complications with that type of approach.
Okay. So what about the armpit area, going through here?
The armpit area is a decent approach. And again, it's another incision where it's not in the breast. But it has its limitations. If a patient wants to have their surgery redone, it's a little bit difficult to go through that incision. You're kind of limited also on size of implant that you want to put in.
Interesting. Didn't know that.
If it's a silicone gel implant, which already comes pre-filled, versus a saline, then you can't make the incision too big. It's in the armpit. So it's
so in the fold of the breast.
Well, and then the one I prefer, Randy, is the one in the fold. That is actually, if you combine all the other approaches, they equate to the number that are done through the fold. So the most common incision done nationwide is through the fold. Through the fold. And it's not really exactly through the fold. You do adjust it so that it falls in the fold.
With a natural breast.
Yes, and this is where a surgeon's technique and a surgeon's experience comes into play. Is that you have to be able to know where to put that incision, so that when the implant sits in its natural position, it's in the fold. Because if you just make it in the fold where it's at, a lot of times that incision ends up being in the breast, and that's one of the reasons that incision, a while back was a little bit out of favor, is because the incision was in on the breast. But if you know where to put it, that incision will never be on the breast.
Now tell me about this. I have a friend that's a plastic surgeon, not a close friend, but and we're talking about this, and he doesn't like to go to the nipple area. He says the most beautiful part of the breast, I don't want to touch it. And so but I know that there's a lot of plastic surgeons that will tell me, and I'm more confused than ever about this. He says it's for the best pocket development. It gives you the most control through the nipple area. And so what are your thoughts, and what's your take on that?
Well, I agree with your friend that says that you don't want to touch, why touch the breast directly? And going through the areola, you are going to, change, the areola shape, the size of the areola, and you're going right through the breast gland. And that does expose patients to problems afterward, inability to possibly not to breastfeed, possible risk of infection.
So there's just more risks.
There's more risk, and I disagree that the pocket dissection or the pocket is where you're going to put the implant in. It's easier to control through that approach. The inframammary approach, you see everything directly.
We're talking about the inframammary. Does that mean in the fold?
In the fold, yes.
Under the breast.
Under the breast.
Okay, we're going to take a quick break. We come back over the muscle, under the muscle. We're here with Dr. Robles. He is the breast surgeon that seems like everybody's talking about in Arizona because of his rapid recovery breast surgery. And his technique is a little bit different than most. And he says it's virtually a bloodless procedure. Women can go back to work. Some go back the next day, even though he recommends a couple of days. But they're holding their arms up, and especially for the redo patients, they just cannot believe that the downtime was so low. This is according to what they tell you. Is that right?
That's correct.
Okay.
Randy.
So when we come back, more about breast surgery and this new rapid recovery lift. We'll be right back. You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, rapid recovery breast augmentation. With us, we have a board-certified plastic surgeon that a lot of people are talking about because of the results he's getting with his patients, Dr. Robles. Okay, so we've talked about a lot of things, and as a recap, I want to make sure I have this right. The reason it's lower downtime than standard breast augmentation surgery is it's less trauma to the patient, the way you're cutting or dissecting.
That's correct.
The breast tissue, and virtually bloodless.
That's correct.
Right? Sometimes bloodless.
Almost all the time bloodless.
Almost all the time bloodless. And so they're going back to work the next day, things like that.
Yes.
And you say, Randy, this is no gimmick.
It's no gimmick.
I challenged you. I said, are you sure this isn't gimmicky?
This is not gimmicky. This is all in the precise technique that I use. And it's taken me over 5 years to evolve to this and to perfect it. So I'm very excited.
And if you're just tuning in now, your center in Arizona you've restricted your practice as a board-certified plastic surgeon to just breast surgery.
Right. I just do aesthetic breast surgery.
Okay. We talked about incisions, your preference. Now, over the muscle, under the muscle, do you put the implants over the muscle or under the muscle?
Well, my preference is what's called under the muscle.
Okay.
But it's really not truly under the muscle. It's partly 2/3 of it is under the muscle and 1/3 of it is under the breast gland.
Okay.
And really to achieve a nice natural result where the implant is going to be positioned in the right spot, it's going to be in that position. 2/3 of the implant will be covered by muscle and 1/3 will be covered by breast gland.
Now tell me this. I guess there are still doctors throughout the United States that are doing over the muscle. Are there doctors doing over the muscle where you are from?
Yes.
Okay. Why are they doing it that way if under the muscle is better in your opinion? What's your take on it?
Well, Randy, if all you have is a hammer, everything's a nail. So
you think it was their training?
Essentially, that's all their training. That's all they learned is how to do it on top of the muscle.
Is it easier, by the way, to do it that way?
It's easier, yes, it's easier. But
you think that's driven by that, maybe, possibly?
It's possibly, yeah. But I just think that that's most surgeons. That's the only technique they know.
Could this be? And by the way, look, I've learned quite a bit at the break throughout this whole thing. But a lot of people, do you think women are going over the muscle because of the low downtime, because of the, you're not touching the muscle? Is that possible?
That is possible.
But with your technique.
With my technique, they recover just as fast as going on top of the muscle.
Interesting. And if people just tuned in, I'm not endorsing you, by the way. But this low downtime breast aug is something that you say less than about 5% of surgeons, plastic surgeons in the country are doing.
That's correct, yes.
Okay, good. Now, so over the muscle, you like under the muscle. The implants themselves, do you like the gel-filled silicone or the saline? What is it for you?
Well, I like both of them. There's a time, or there's patients that are going to benefit from a silicone implant, and there's patients that are going to benefit from a saline implant. And so I take and I listen to the patient and what they want, and then when I examine them, I will recommend a silicone versus a saline. I believe they're both good implants. So it's not just all saline, all silicone. And
but doesn't the silicone feel more natural? I mean, it does. We've had doctors on the show, and I've had them in my hands. One feels like flesh. One feels more like a water balloon. Well, so in my opinion, I was thinking, it seems like when I had it in my hand on the show, right here on this table. So you tell me.
Well, yes, Randy. If you have them here and you're feeling them, the silicone gel will feel a little bit more firm or more natural. But you have to remember, when you're putting it inside the body, you have tissue, muscle, and breast tissue covering the implant. So really, they shouldn't feel the saline when you put them in. If you're doing it the right way, you're dissecting and making the pocket the right way, the saline is going to feel just as good as the silicone does. But if the patient doesn't have adequate tissue coverage, then you want to go with the silicone gel implants. So, but yeah, I agree with you. Here, it's going to be
that's a good point, by the way.
A significant difference, but not when you put them.
Not necessarily a fair test.
Exactly.
We're out of time. But one of the things you said early on when we talked was that if you don't like your breasts, it can hold you back in life. Elaborate on that.
Well, Randy, there's some women that don't like the way they look in clothes, and there's some women that don't like the way they look in a bikini top, and they want to be able to feel good about themselves, have more self-confidence, and getting a breast augmentation gives them more self-confidence.
Do they tell you, by the way, that they're avoiding things because of their breasts?
I've had patients that tell me I haven't worn a low-cut blouse because I'm not happy with the volume of my breasts. I've had women tell me I don't wear a bikini top because my breasts are too small.
Is that right?
Absolutely, and it really changes. I see it all the time. They come in and see me, and they're wearing very conservative clothes after their breast augmentations. They not only come in, with a lot more self-confidence. They come in with, clothes where they're really, showing off their body. They come in with their spouses. The spouse has a smile on their face, and they love the way. So if you don't like your breasts, you could do something about it. I can do something about, I can do, if a patient is not happy with the size of their breasts, the droopiness of their breasts, and even if their breasts are too big, I can give them a beautiful rapid recovery.
Rapid recovery
breast
So everybody
surgery.
in Arizona is going to go, that's the guy, the low downtime, rapid recovery. What do you like better, rapid recovery, breast augmentation, or low downtime?
Rapid recovery breast augmentation.
But it is low downtime as well.
That's correct.
How soon could they be back?
I've had patients back in 24 hours, back to work.
So have you heard them, and you don't recommend 24 hours, right?
No, I recommend 3 days.
But they do it anyway?
They do it anyways, yes.
Somebody wants more information, they can go to your website, make an appointment. That's your message?
Absolutely right.
And they still get to meet with you?
Yes, they do.
No fee for the consultation?
No fee for the consultation.
There's nothing to lose, right?
That's right.
I'm kidding around. Well, I want to thank you so much for coming on the program. Very interesting. Rapid recovery breast surgery with Dr. Robles. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. Just put in breast surgery or Arizona or Dr. Robles, and you'll find it there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.